Assalamu alaikum and very warm welcome to the informative globe by Hafiz Sanaullah Zakir YouTube channel. Please watch the video from the beginning till end and please subscribe my YouTube channel. Today our topic is about pharmacology, sedative and hypnotic drugs. So let's start. Sedative and hypnotic drugs. Now, what is the meaning of sedative? What are sedatives? Sedatives are those drugs that reduce excitement and while hypnotic are those drugs which induce sleep. Sedative are those drugs which reduce excitement and calms patient without inducing sleep, and while the hypnotics are those drugs which induce sleep, which brings sleep. Okay, so the sedatives in therapeutic doses are also called anxiolytic agents, mean those agents which reduce anxiety. So first of all, little bit I will tell that what is anxiety and what are the symptoms of anxiety. Anxiety is an unpleasant state of tension, apprehension and uneasiness, mean a fear that arises from either a known or unknown source. The physical symptoms of anxiety are similar to those of fear, such as tachycardia, trembling, sweating, and palpitations, and involve sympathetic activation. Episodes of mild anxiety are common life experiences and they don't warrant treatment, while the severe chronic debilitating anxiety may be treated with anti-anxiety drugs, also called anxiolytics, or some form of psychotherapy. So many anxiolytic drugs also cause some sedation, so they are both clinically used as sedative and hypnotic drugs, also called anxiolytic agents, the sedatives. So first of all, now I will come on the classification of the sedative and hypnotic drugs. First class is Benzodiazepines and the second class is barbiturates and the third one is other hypnotic agents. Then the benzodiazepines are further classified into its own drugs according to the duration of action. For example, the benzodiazepines are classified into three groups. Number one, short acting. Their duration of action is from 3 to 5 hours. The drug include here is triazolam. And number 2, intermediate. Their duration of action is from 6 to 24 hours. Intermediate from 6 to 24 hours. In intermediate, the drugs present by your own formula, you can remember these drugs. For example, my own formula is Elliot, mean from A, alprazolam, from L, lorazepam, from E, estazolam, from O, oxazepam, from T, temazepam. And the third one is long acting drugs. Their duration of action is from 24 hours to 72 hours. And their formula of remembering is Sidpakpin. It's my own formula. This is the easy way to remember the drugs of each class. So now come here. From C, chlorazepate. From the second C, chlordiazepoxide. From the D, diazepam. From F, flurazepam. And from Q, quazepam. And from P, pyrazepam. From N, nitrazepam. So these were the classification of benzodiazepines according to the duration of action. Now we will come on the barbiturates, the second class. Barbiturates are also classified into its subgroups on the basis of duration of action. Number 1, long acting. Their duration of action is 6 hours or more than 6. And the drugs include are PB. From P, phenobarbital. And from B, barbital. Second one, intermediate are duration of action is from 3 to 6 hours. The drug include are AT. From A, amobarbital. and from T butyl, and the third one is short acting. Their duration of action is less than 3 hours. The drug include PS, from P pentobarbital, from S secobarbital, and the third class is hypnotic agents, mean which induce sleep, those agents which bring sleep. Their formula is Adder's, from A antihistamines, from D doxepin, from E isopiclone, from R rameltione, from S suboruxant, and from T tazimiltione, from Z zolpidem, and from another Z zaleplon. Now I will tell you people the mechanism of action of benzodiazepines. First of all, what are benzodiazepines? Benzodiazepines are widely used anti-anxiety drugs, mean anxiolytic agents, because they are largely replaced barbiturates and are meprobamate in the treatment of anxiety and insomnia, because the benzodiazepines are generally considered to be safer and more effective. While benzodiazepines are not necessarily the best choice for the treatment of anxiety and insomnia, certain antidepressants like selective serotonin reuptake inhibitors are preferred in many cases of anxiety, and the other hypnotic agents and antihistamines are preferable in the treatment of insomnia. Insomnia mean when there is the deficiency of sleep. Okay, so now we will come on the mechanism of action. First of all, I will draw the schematic diagram of GABA benzodiazepine GABA chloride ion channel complex. Such a diagram is drawn here, and the subunits like alpha, gamma, beta, alpha, then gamma, it is cell, the first diagram is known as receptor empty mean no agonist. In this schematic diagram, first one is receptor empty. Here the receptor empty is inactive and the chloride ion channel is closed. Okay, no chlorine influx occurs here. And in the B diagram, receptor binding GABA naming, here the GABA binds with its receptor and the binding of GABA causes the chloride channels to open, leading to hyperpolarization of the cell. Okay. Number 3, receptor binding GABA and benzodiazepine. Here in this diagram, the GABA binds to its receptor and the binding of GABA is enhanced by benzodiazepine, causes the entry of, so greater entry of chloride ion occurs, and the entry of chloride ion hyperpolarizes the cell and making it more difficult to depolarize, therefore reduces the neural excitability. So the general mechanism of action of the sedative is they act on the limbic system, which regulates mental thoughts and mental function, while the hypnotics act on the midbrain, which maintain